Hello, thank you for waiting. I'm going to start second session of webinar for Gonioscoop. If I'm going too fast or I'm not clear enough, please let me know. Thank you. So for today's session, I'm going to do the revision from session 1 and plus offer additional information and about marketing, and gonna introduce few clinical cases. So I explained that there were 4 main examinations to diagnose glaucoma, which is IOP, intraocular pressure, and perimetry for the visual field, and fundus, and gonioscopy. However, the reality is only half of the patients receive gonioscopy examination. So what Nidek GS-1 can do is it is less learning curve compared to conventional gonioscopy method, then that makes it more familiar examination. So here's additional information about gonioscope, and it is contact method, but multimirror prism lens does not touch the cornea, so we can say that this is semi-contact. As shown in the image, multimirror prism lens does not touch cornea directly. In between, there is a gel or GS gel. And we also provide gel designed for GS-1. And for the multimirror prism lens, for the disinfection and sterilization methods are shown in here. For disinfection, alcohol wipe can be used up to 100 times per lens. And for sterilization, ethylene oxide gas, EOG, can be used up to 30 times per lens. After that, you should replace to the new lens. So for the sterilization, I said to use EOG, ethylene oxide gas, and autoclave cannot use for gonio lens because the temperature is too high and the multimirror prism's coating will be damaged. So please do not use autoclaving for sterilization. And this is also from a previous session that there's 3 types of gonioscopy. One is static, dynamic, and indentation. And for Nidek gonioscope, we can do only static because I explained before the lens does not touch the cornea. So let me explain a bit about indentation. So indentation is to press gonio lens to the cornea to artificially open a knuckle. So this is before indentation, and this is during the indentation. So as you can see, there's the lens are pressing cornea to make a space between cornea and iris. On the left image, it is clear that both left side and right side here part looks similar. However, after indentation, left side there is a space. On the right side, it is still closed, and then this is called PAS, and PAS stands for peripheral anterior synegia. So why doctors do indentation is to determine whether angle closure is occurred by iris opposition or peripheral anterior synegia. And there's another information about glaucoma case, and 90% of all glaucoma cases are open angle glaucoma. So here's a comparison of conventional gonioscopy and gonioscope. Please note that these two images are not the same patient's eye. We are collecting data right now. So on the bottom of the features table, because Nidek Gonioscope is automated gonioscopy, it has good repeatability and simplicity. And we also have storage, about 80 gigabytes, and also has good view field. We can capture 360 degrees. And the time, it takes about 16 seconds to capture when it's full capture. And GS-1 can do static as well, but not indentation. And it is semi-contact, so it's still contact, not non-contact. If you have any questions during the presentation, please let me know. I will answer after the presentation. So for the pre-marketing, here's a list of activities from 2017. We had symposiums and also posters, exhibition, and for the material, we provided leaflet. And in 2018, we already had symposium at WRC, and we will have another symposium at ESCRS in September. And we're also going to provide posters and exhibitions at following Congress. And also for materials, we will provide brochure and also clinical data book. For the launch of Gonioscope is at ESCRS. This is a leaflet we provided earlier. And for ESCRS Symposium, we have 3 speakers, Professor Traverso from Italy, and Dr. Homa from Austria, and Professor Renato from France. So here's another information, hot topics in glaucoma field. I would say this is gonna be mixed. So this is a little information from Allied Market Research. And it stated that mixed value at $144 million in 2016. And it is estimated to increase to $912 million in 2023. And the table below shows mixed device market by surgery. On the left side is triple surgery, which is glaucoma surgery, MIG surgery and cataract surgery and IOL. And the right side is standalone glaucoma surgery. As you can see, there is a dramatically increase in 2023. And this is mixed device market by product, and it shows in 2023 there will be more on mixed stent and following mixed shunt and other mixed device. So mix is one of the glaucoma surgery technique. However, cataract surgeon can treat as triple surgery, which is phacoemulsification, IOL implantation, and mix. So here's the number of procedure, and if you could see the red color bit, this is mix specifically for eye stent. This is a dramatic increase from 2012 to 2016, and it is estimated to increase more in the future. However, when you look at the whole ophthalmic surgery market, about 60% are cataract surgery and only 1.7% are for glaucoma surgery. And here's the number for number of surgeries in 2016. So this is from Gonioscoop survey in US that 43% of cataract surgeons are using iStent, and additional 11% of cataract surgeons are planning to use iStent, which means there are more than 50% of surgeons to use MIGS, which leads to 13 million surgery per year. So this is also from section 1 that states the surgeon should perform gonioscopy before MIGS. This is from iStent, and the bottom is from Cyprus. Gonioscopy should be performed. So what I wanted to emphasize is that there will be a lot of surgeons to use MIGS, and who does MIGS should perform gonioscopy. So there's a lot of market for us. And for the strategy, for glaucoma specialists, is to have an EBM, evidence-based medicine, or influence the market. And for the cataract surgeon, a MIGS user, they must see the angle for MIGS implantation. For generalists, it requires to do gonioscopy to diagnose glaucoma, and this is from glaucoma guideline. And our target is, I brought this example, that a Goldman applanation tonometer. We have non-contact tonometer, which is our NT series. So our goal is to standardize Gonioscoop as a glaucoma screening device. Right now, gold standard is gonioscopy. So one little message. This is one of the study about endothelium cells observation in glaucoma surgery. So this study showed that after glaucoma surgery, such as express or trabeculectomy, it says that there's a decrease in endothelium cell. So this is not from Gonioscoop, but we can also say that the surgeons should use specular microscope as well, not only for cataract surgeon or MIGS. And here I'm going to explain few cases. This image was captured by Gonioscoop, and the case of open angle with pigmentation is this area. This is provided from Professor Pinto from Portugal. Another case is angle closure with minor gap, which is this part. I understand this is really difficult and complex to understand the Gonioscoop image, but when you compare with open and close angle, it is clear that there's many lines are not visible in close angle. And this is another case, the implantation of MIGS. In this case is iStent. Because we capture 17 different focus for each area, it is possible to focus directly to iStent. And here's another case of neovascularization suspect. Different from previous picture, you can see that there's a tiny blood vessels on the angle. And this patient is a diabetic patient. And the final case is called iris process. It is often mistaken by Nidek, but it is different. And of course, we are preparing to make how-to video and clinical data book, and it is coming soon. We are going to upload on Nidek support library. So here's the summary of Gonioscoop. I listed the benefit for each specialist or surgeon. For glaucoma specialist, Gonioscoop can save time because doctors don't need to record by themselves, drawing, coloring on the goniogram. And it can be used for patient education, and also it provides treatment strategy. For cataract surgeon, the mixed user, it helps for easy approach to mixed practice. And for the generalist, Gonioscoop can provide more information to diagnose glaucoma and could be the last piece to glaucoma diagnosis. That's it for the second session of Gonioscoop. Thank you for your attention.